Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Son Young-rae, the Director General of Department of Strategic Planning at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 469 new cases of COVID-19 on Wednesday. Let's take a listen.
Let us now begin our regular briefing for March 17th, Wednesday. As of today midnight, we have 452 new local infections and 17 new imported cases. And we had 8 additional fatalities, and I extend my deepest condolences to the deceased and the members of their bereaved families. First of all, here is an update on our quarantine response capacity. Yesterday, we have carried out a total of 76,000 tests yesterday, and at the makeshift testing centers in the metropolitan area, we carried out about 30,000 tests as well. And as for our updates for the medical response capacity, here are some details. We have 100 patients with severe or critical conditions, and we have also 603 hospital beds available for the intensive care units, and we also have about 10,000 hospital beds for those with moderate or mild symptoms, and we have 0 patients who are waiting to be administered to the hospitals. And we also have about 6,800 foot traffic during the weekend, and this is a slight increase from the previous week. And also compared to December, this is on the same level of some 6,600. And also in the metropolitan area, we have seen that the foot traffic have increased slightly by about 2.3%. And also in the non-metropolitan area, we have seen an 11% increase in the non-metropolitan area as well. And we believe that starting from January, we are seeing a steady rise in the amount of foot traffic. However, on a daily basis, we see our daily tally hovering around 400, and we also have day-to-day venues being the subject of large cluster infections. And the COVID-19 is on the verge of another resurgence here in South Korea, and we ask for the individuals of the public to also take particular precautions and participate in our quarantine measures. And yesterday we have revealed the special quarantine measures for the capital area, and aside from the intensified quarantine and crackdown, we will be also carrying out pan-government efforts as well. Starting from the 15th to 28th of March, our government ministries will be also looking at the quarantine status for all of the public use facilities, and they include all of the facilities, including public saunas, as well as private cram schools and migrant workers community as well. And we will also be making sure that the quarantine measures are also abided by at some outdoor spaces as well as tourist destinations ahead of our spring weather. And we will also carry out a massive testing and preemptive testing for the COVID-19 patients as well. And here are some support schemes for those who have recovered from the COVID-19 outbreak. And we have about 97,000 of the total tally of the COVID-19 here in South Korea, which includes all of the people ranging from the medical practitioners who have been exposed to the virus while treating patients with COVID-19, and also there are family members who have been infected with the virus through their other members of the families. And while most of them are returning back to their society, however, there are also some people who are having difficulties and facing discriminations when they return to their society. And all of these societies and corners of the society are also compelling them to submit a negative PCR document, or also mandating all of these recovered patients to work from home as well. And also there are many people who have not received the living allowances for these COVID-19 patients who were on isolation. And the government, to this end, in order to facilitate and help all of those who have recovered fully from the COVID-19, we will be providing more support. And when these people return to their workplaces or schools, the submission of a certificate given by the government will suffice, and they would not need to submit an additional PCR negative document. And we believe that this certificate given by the government is suffice to tell others that they do not have any other risks of infecting others for COVID-19. And this is a standard set by the WHO as well as the recommendations by medical experts here in Korea and overseas. Nevertheless, we also have some workplaces that are mandating those people who have recovered to submit a PCR negative document, or forcing them also to quit work or even work from home, or also go on unpaid leave. And we have seen that these were some of examples of discrimination put forth by these workplaces. And the Labor Ministry would also provide specific guidelines for those who are returning back to their workplaces so that they do not face discrimination. And we will also make sure that if there are breaches of these guidelines, the workplaces and managers will be faced with stern legal measures. And we also once again ask the workplaces as well as managers to help and facilitate the people who have recovered from the COVID-19 to return to their workplaces smoothly. And to this end, also, we are going to intensify our insurance coverage for those who have recovered from COVID-19 so that they do not face further discrimination when they are subscribing for new insurances. And we also have seen some of the discriminations, and there were also some forceful recommendations as well, and these measures will be faced with stern legal measures as well. And as for the support allowances, we have also secured a significant amount of our budget as for the allowances for Q1, and we will also be securing more amount of money for Q2. So these allowances will be given out to those patients on as soon as possible. We would also like to intensify our psychological support for those who have recovered from COVID-19. The National Traumatic Center will also provide continuously any consultation sessions that are needed for these recovered patients. And the local authorities are also providing individual recovered patients with such related services. And for instance, the Seoul Metropolitan Government is also providing tailored services, and the Seoul City is also going to provide a 4-week program to look into their health conditions. And as for these details, please refer to our hotline that is available. And aside from all of the above mentioned measures, we will be also intensifying our campaign to change the stigma or the discriminations or the perspective that the public have on those who have recovered from the COVID-19 disease. And we would like to once again highlight that the public needs to give encouraging words to those who have fully recovered from the COVID-19 virus. And the government will also make sure to exert our full efforts to enable a fast return to a state of normalcy, and we ask for your efforts as well. And until next week, until the end of the special quarantine measures here in the capital area, we ask the residents in the capital area to also go to the test centers as soon as possible if you have any clinical symptoms. And also at multi-use facilities and workplaces, we also ask for your continued compliance to the quarantine measures. Thank you very much.
That was a government briefing on the COVID-19 situation from the health official Yoon Tae-ho. South Korea reported 469 new COVID-19 cases on Wednesday. This brings the accumulated number of COVID cases to 96,849. There have been 8 more deaths, raising the death toll to 1,686. We'll wrap the coverage here, and we'll be back at 12 Korea time with our midday news with Mark Broom. Bye for now.